Hello. Hi. Yeah, Bruce from Motif. I'm the co-founder and the CEO, and I started the business back in 2012. This all came from when my first son was born. I was tracking my sleep and the impact of poor sleep on my quality of life and my health. And as any parent in the room knows, obviously the sleep was terrible. So it was really interesting to be able to start simply and easily getting a handle on how bad the sleep had affected me. And back in 2012, I started working with Ben, who I set the business up with, and we met people from the Cure Parkinson's Trust. Quite soon after, we came up with these ideas about how could we track ourselves really simply and easily and to feel a bit more in control. And as soon as we met the Cure Parkinson's Trust, they said, well, you know, this technology that we were developing would be fantastically useful for those people to help manage a serious long-term condition. So we kicked the business off in 2012, and that was working with the Small Business Research Initiative, some pilot funding that started us going. Fast forward to now, and as I'll talk you through in a moment, we're now in 14 different clinical conditions, delivering up and down the country in the US and in Australia. And what we see is the critically important thing is activating patients and care teams with the view to being able to improve quality of life. So let's just check that this is... There we go. Great. So what we're all about is a technology company, and I'll show you how the simple and easy to use apps help people to track and take more control of their health and provide a personalized digital tool to help everybody manage their treatment pathway. And I think what we're seeing is the inevitable shift that's coming, where digital is going to play as great a role in our health lives as it does where we book our flights online, go to Amazon, go to Tesco, wherever it may be. All of those services are simple, easy to use, straightforward and centred around the individual. And that's what we're hoping to help drive in healthcare as well, that focus around the individual. So the approach that we take is very design, evidence and clinically led. Our clinician, Rashmi, worked in the NHS and brought all of her expertise to help us design a platform that really focuses on the left-hand side there, all around the patient, actually all around all of us. And later on, I'm going to be asking you to get involved with something yourselves as well. So we start with a focus on what do people want to do. Now, quite often what we hear at these kind of events is very system-led. You know, what does the system have? What does the system want to share? Medical records, the notes, the this, that and the other. Well, actually, where we go and talk to a lot of patients, they kind of want that sometimes, but what they want more are tools where they feel more in control, that really empower them to do more and be more engaged with their health. So we start on the left-hand side, and our approach is what can we give people now, today, that they can start using that happens to inform their relationship with their care team, can empower that, improve shared decision-making, but as a consequence of them engaging with a tool that they want to use for their own good, not because the system's told them or asked them to. That data then that's captured is not only used by care teams, but also by providers and up to commissioners. So almost the data that we're going to need in the future of outcomes-based commissioning is thrown off as a result of patients engaging in their health, not because a system has asked the population, please fill out this PROM or PREM or whatever. Our approach is let's start with people and then get the data as a consequence of people engaging and doing what they want to and what they're looking for in their normal daily life. So the platform that we've created captures 4 key types of data. First, on the left, symptom data, allowing people to track how they're feeling. You know, symptoms is something that 100 years ago we would have been talking about here. How you're feeling, how you're getting on. Very subjective, very human, and it really builds up a better relationship between patients, carers, care teams, and clinicians. We also help people track their medications to adhere better to their meds and understand what they're taking and when. We help people track their biomedical details, weight, blood pressure, blood glucose, and connect in wearable devices, which will become more and more prevalent. And then also, importantly, fill out surveys and questionnaires, whether that's a baseline questionnaire, a consent questionnaire, or the traditional sort of PROMs and PREMs, but digitally delivered, as well as things like friends and family tests. And it's over on the right-hand side. This is the powerful data for commissioners and for providers to understand are outcomes improving, but this is as a result of people engaging with a tool that's great for them. So we've had quite a bit of experience over the last 3 years. Here's a few of the people that we've been working with up and down the country, working with some great NHS organisations, great other partners like ABL Health up here in the north. Also Remedy Healthcare, it's our first Australian client, supporting health coaching for pre-diabetes. And the Brigham and Women's Hospital in Boston is our first US client, and a second hospital signing this week. What's really exciting is I do think we've got quite an incredible opportunity in the UK to do stuff here that exports incredibly well, but on the basis of what we can do in the NHS, and together in sort of a really nice partnership approach with many great institutions here. So we've been delivering a range of projects, and also a randomised control trial, results out soon. We had the fantastic Walton Centre, thanks Liz, on board as one of our centres, Newcastle, Cambridge, Kings and Forth Valley and others. So really large-scale randomised control trial, probably one of the largest ever for a self-management app in Parkinson's, looking at medication adherence. Can't share the results yet around the primary endpoint. What I can share, though, is incredible engagement. So most people were over 65, most people had multiple long-term conditions, and 80% of people used the app over the 112-day trial period. That's 16 weeks, which is phenomenal. Most apps get maybe 20, if they're really lucky, 30% retention over 90 days. We were at 80. Really proving that people that you would maybe not expect to want to use this technology do want to use it, because it empowers them, because they feel more in control, and it helps them have a better consultation when they go back to see their clinician. So testing in the clinic, but then we're also testing and deploying at scale. Some of you may have seen the project that we launched with Manchester University and the BBC about a month ago, called Cloudy with a Chance of Pain. So this looks at the association between weather and symptoms. So how many people think that chronic pain and arthritis is affected by the weather? Just do a show of hands. Yeah, it's probably quite representative. So 84% of patients think that there is an association. It's a question that goes back to Hippocrates, but nobody's ever been able to prove it. So with Dr. Will Dixon and the team, we've now got 8,000 people registered to this study, probably now over 800,000 data points collected from patients, and we're using the phone's GPS to get the local weather station, and people are submitting their symptoms every day. So fantastic uptake across the country that people want to get engaged with something and take better control of their health. Tantalisingly, I'm going to leave 100 for Parkinson's for a moment, because that's something that all of you can take part in as well. So quickly to run you through the platform, there's an app for patients that works on iPhone, Android, devices, mobiles and tablets, and also the web. And then a web dashboard for care teams that the data goes back to. Obviously, we've done IG level 2, HIPAA secure stuff in the US. Data protection is really key. People own their own data is our principle. They opt in for their clinicians at their centre to be able to view their data. And each of the client deployments has a separate database. So Liverpool's data is kept separate to Manchester's. One of the core interfaces is the Motif, a really beautiful and easy tracking interface. What you do is you just swipe each of those segments or petals in and out to give yourself a score on symptoms relevant to you. And when you all sign up in a moment for 100 for Parkinson's, you'll be able to see how easy this is to use. The great thing is symptoms are what the 80-year-old, the 40-year-old, the 20-year-old can all input. It's something that is deeply rooted in our human behaviour. How are you feeling? How did you sleep last night? What's your mood? If you've had a heart attack, how's your breathlessness and your anxiety? Clinically relevant symptom tracking based on a question set of over 250 options, but tailored to each clinical condition. So we could come and deliver with you and your care teams and pick a particular question set for any of the 14 or more clinical conditions we've been working in. So simple, easy design makes this stand out. And what's key about what we do is the design looks as good as any other consumer internet app. People aren't happy with an Excel spreadsheet on a phone anymore. They have an expectation of sort of design quality, which is as good as anything else. People can also fill out their PROMs and PREMs survey questionnaire at baseline and throughout. Friends and family tests, EQ5D. You know, there are a whole list of ones that we can upload. People can set up their own medication regime, get timed reminders, and also take pictures of their pills. On our website, there's a really nice video from Sam, patient in Parkinson's from the Walton Centre, who, by tracking her medications and her anxiety attacks, realised with her clinician that she needed to change the timing from her medication dose from the evening to the morning, and that took away all of her anxiety attacks. So a huge impact on her quality of life because she was able to upload her own regime and track her own meds. One thing from the clinician side that people like, for a change, you can not only see the prescription meds, but also the over-the-counter medications. It's information that's a massive gap at the moment, but because people are choosing to use this tool to feel more empowered, it gives the data, or provides the data to the care teams for the first time. People can record a daily diary, food diary, by taking photos or adding text-based notes. They can upload their wearable device data, daily steps, weight, blood pressure, blood glucose, that sort of thing, to make it nice and easy for people. And importantly, there's also delivery of content. So what we often hear from patients, this is so useful that they have a trusted source of content to go to. Because this comes from you and your care teams, or a charity, or a patient group, or a trusted source like NHS Choices, people know where they need to go to for their information. And this can be tailored very locally to, what's the car parking arrangements at the Walton Centre, for example. It's information that patients want to turn to and find easily accessible. So it's a great, easy-to-use app for patients. The data gets sent up automatically, synchronized to the cloud, where it's kept safely, securely, all backed up and encrypted. And then care teams can also have a dashboard to view that data. Main thing for any of you out running services, we could come along and set up your version with your logo, your question set, your proms and prems tools, your content and what you need, and we could have that up and running within a week, if you can be quick enough. Our technology is built, ready, so that it's nice and simply accessible. So we're really keen to get out there, making more of an impact on things like reducing readmissions, improving quality of consultation, self-management, and a range of other benefits as well. So please do talk to me afterwards. However, I just want to end on one thing. So I want you to all get involved in something. North West Coast AHSN are kindly supporting us, as are a number of other sponsors. And a bit like Cloudy with a Chance of Pain, you could sign up to that yourself if you have chronic pain or rheumatoid arthritis. But this is another citizen science project. So what we wanted to do was get out to more people, make more of an impact by getting these tools into the hands of more people across the world, but also build up an incredibly useful research database. So the idea with 100 for Parkinson's, it's a global citizen science project open to any adult with a smartphone. And what you'll do is you'll download the app, the Motif app on Android or iPhone. If you're on an iPad, search for iPhone-only apps, by the way. You download the app, and then you pop in that study code, or at the back of the room, I've left some of these cards. It's got a slightly different code. Both work fine. Or I can give you these later. If you pop that study code in, you'll be led through the onboarding process. Maybe don't do it now. Take a bit of time later. You'll set up the app to track what's important for you for the next 100 days. You'll be tracking using the Motif and other aspects of the app for 100 days. And the anonymized data set, we're going to all donate that data for free for research. So that huge data set, we're hoping to get to 100,000 people. So 10 million person days of data will be made freely available to any researchers, overseen by a data governance committee chaired by the Cure Parkinson's Trust, but in the Sage Bionetworks Synapse platform. So what we'll all do is we'll learn a bit more about our own health. We'll get a bit more engaged in our own health, but we'll also be donating our data to make a massive impact for Parkinson's and other research now and long into the future as well. This is live now. You can sign up today. It goes out to the press on Thursday this week. Liverpool School of Tropical Medicine are our kind of research partner. We've done ethics for the UK through there. And then later this week or next month, it's going to go live in the States and be quite a big global project. So thanks to North West Coast AHSN for their support. We've got a range of other great sponsors and partners. And please do sign up yourself. You'll get a great chance to have a look at the app and learn more about yourself. And do encourage your patients, your population, staff, colleagues and others to get involved. And so that is us. But I'll leave that screen up there so you've got the code, or there are some of these at the back, and we look forward to talking more. Thank you.
Thank you.